What's up? What's up? What's up? It's Dr. Mia at Me Bella Wellness Center, where we offer gynecology to women and adolescents of all ages, as well as total wellness solutions for both men and women. Our goal is to help you live well, age well, and experience everlasting intimacy. It is Wellness Monday, and we are going to talk about some total wellness things that you can be doing. And when I talk about total wellness, that means what are some of the key strategies that you can use to live your best life through total wellness. So that means, like, what are some key strategies to help you maintain a healthy weight? What are some key strategies to make sure that you're getting your exercise in on a regular basis? What are some key strategies that you can use to prevent disease and to, get your screenings done? So today, let's just talk a little bit about colonoscopies. A lot of people are afraid of colonoscopies. A lot of my patients are saying that they're getting the Cologuard over the colonoscopy. The new recommendation is to have your colonoscopy starting at the age of 45. Usually, if they see a polyp that's benign, they're going to want it every 3 years. If you have a strong family history of colon cancer or one of the genetic mutations associated with colon cancer, they want it every 3 years. And sometimes it's every 5 years, sometimes it's every 10. Usually after they do your colonoscopy, they give you the information and the person that brings you, because of course you're kind of out of it because you've had some medication. But the importance of the colonoscopy is that it is the only screening tool. It is one of the only screening tools that we have that actually decreases your risk of cancer or prevents cancer. Because with the colonoscopy, the big deal about it is you have to clean out. So you got to drink all this stuff. You have to have a clear diet the day before. Very small task to prevent colon cancer, might I add. And so it's the prep. And once you do the prep, you go to the hospital and they are going to give you some medication to relax you. You wake up, it's done. You don't remember anything. You have no pain, no discomfort. You just kind of wake up thinking that they're about to start and they're actually finished. So it's a very seamless process for the average person. But the thing is if when they look in there after you've cleaned out really well and followed all the instructions, if they see a polyp, it's usually benign and they can remove that, which prevents that benign polyp from turning into cancer down the road. So again, it's one of the few screening tools that we have that actually prevents cancer. The other one is pap smears, and we'll talk about that at another time. So I recommend for my patients to go ahead and just get that colonoscopy. Don't worry about the Cologuard as much because it's not going to be able to get rid of the polyp. All you're doing is taking a test to see if you have any blood in your stool. Well, if you have a very small polyp, you may not have blood in your stool. That may come back negative, but there is a polyp growing. I don't know exactly how long it takes for polyps to turn into cancer, but it takes quite a long time, which is why they schedule your colonoscopy so far and in between. And that's why if you have a history of polyps, you get them sooner. So 3 years, 5 years, or 10 years. So starting at the age of 45, please get your colonoscopy. Use the Cologuards for in between time, but get those regular colonoscopies because they prevent cancer. And again, my goal is to share good information with our community. The one thing about it, I have all kinds of patients, and some of my patients are automatically going to get great care. But I also have those patients who are Black and brown, and we don't always get the best care in America or Alabama. So what I say is everything that we can do to prevent disease is going to be our best option, because studies show that there's a huge health disparity and it has nothing to do with anything else except for the color of the skin. So if you are Black or brown, you should be the first person running to do everything you can for prevention, because our health outcomes are so different from everybody else. So get your colonoscopy. It's not a big deal. It prevents cancer. It saves lives. And it's a normal screening tool that, again, prevents cancer. So get your colonoscopy, not the Cologuard. All my patients know. Get the colonoscopy. When they tell me they had a Cologuard, I tell them, so what? Get a colonoscopy. And of course, if there's something else going on, like you're really high risk, you can't go to sleep, you have a history of some kind of colon problems, that's a different conversation. But for the average person that sees me, colonoscopy is definitely the best option. So go schedule yours today if you're over 45 and haven't had it. If you're over 45 and it's time because it's 3 years, 5 years, or 10 years past your last one, please schedule your colonoscopy. It's quick, easy, and to the point, and it can save your life. It's Dr. Mia at Me Bella Wellness Center. I will see y'all tomorrow. Bye.